Good morning, everybody, and a very, very warm welcome to you indeed for day 2 of the conference. And first, I want to acknowledge the Kaurna people of the Adelaide Plains as the traditional owners of the lands on which this conference is being held. And I acknowledge the traditional owners of the many lands from which our virtual participants are joining us. I pay my respects to their elders past and present, and to First Nation elders and members of other communities who may be here either in person or online. Now I would like to introduce our first speaker of the day, Maree McCabe, AM, Chair of the Aged Care Quality and Safety Advisory Council and outgoing CEO of Dementia Australia. Maree brings extensive experience and expertise to the health, to the mental health and aged care sectors. Her career accomplishments include leading the former Federation of Alzheimer's Australia to unify and become Dementia Australia. So please welcome to the stage Maree McCabe.
Thank you so much, and good morning, everyone. It is so great to be here with you. And I acknowledge the traditional owners of the lands on which we're meeting today, the Kaurna people, and pay respects to elders past and present, and to any Aboriginal and Torres Strait Islanders present with us today. And I welcome everybody that's joining us online. And I hope you enjoyed the dinner last night. It was lovely to catch up with some people and have a chat, and I look forward to catching up more with other people in the breaks. Now, I'm sure that you will agree that this national conference is a fantastic way to hear from, to engage directly with the Commission, and also share our thoughts and ideas, and to network with colleagues. And Janet, my thanks to you and the team of the Commission for organising this conference. I know the months that have gone into the preparation, and it has been absolutely wonderful, and the feedback from yesterday was fantastic. So please give Janet and the team a round of applause and acknowledgement. Colleagues, we work in a sector, and you well know, that has been under the spotlight since before the Royal Commission, and certainly the glare has been intense over the past 5 years. And it certainly hasn't been comfortable, and quite the contrary on occasion. And we are, after all, part of an ageing society, not just nationally but globally. And I think for the first time in Australia, we have more people over the age of 65 than under the age of 15. The number and proportion of older people in Australia continues to grow, and we as a country will continue to work to improve how we support older Australians, ensuring that they continue to enjoy the best life possible right to the end of their lives. Certainly that's what the Royal Commission concluded, and that's what older people have the right to expect. And all of us at the conference understand the need for ongoing improvement in the work that we do. We all have direct and valuable experience and insight through our work, through our family, and through our friends. And if I said now that it's an exciting time to be working in aged care, some of you might query my choice of words and say that it's a bit daunting. But it's certainly true that there are lots of reforms, and it's also the case that older people have been waiting a long time for some of these improvements, and others see it absolutely essential. Now, I do want to say congratulations to you. This has been an extraordinary time in aged care. And I know that there have been a number of reforms that you have implemented. I mean, there's the 200 minutes of care, the 24/7 RNs, there's SIRS, there are so many, and now the Aged Care Act is coming into play. And I really thank and acknowledge you for the extraordinary work that you have done. And I do also acknowledge the incredible pressure that you've been under in implementing those reforms. So congratulations. You should give yourselves a round of applause. I think it's truly amazing. If I had to single out one I think probably the biggest impact to date would be the wage increase for aged care workers. Now, I know that that's been a game changer and long awaited in the aged care sector. Arguably, the most significant and extensive reform of all is still coming in form of the new rights, I can't get this right myself, the new Rights-Based Aged Care Act. And this Act is fundamental to achieving the reforms recommended by the Royal Commission and is certainly a vital framework for this change. And central to providers' delivery of safer, higher quality care that meets expectations will be our engagement, our listening and our co-design with each older person in our care. This conference is a fabulous opportunity for us to explore together in depth key implications of the changes that will be introduced in the new Rights-Based Act, things like the new arrangements for market entry and market participation, involving a process in which providers will register in a particular category, and those categories have specific obligations that will apply to them. Now, for some registration categories, these regulations will include complying with new strengthened quality aged care standards, and all of these arrangements will be part of a new regulatory model in which the Commission will continue to play a central role. My reference to the regulation of the sector is a useful segue to the work of the Aged Care Quality and Safety Advisory Council that I have the privilege of chairing. The Advisory Council is a body established in legislation under the Commissions Act with responsibility to advise the Commissioner on the performance of statutory functions and to advise the Minister on these matters at request. Now, membership of the Council, I think you may know, is currently being reviewed, and I take this opportunity to acknowledge our outgoing members wholeheartedly for your incredible and valuable contribution to the Advisory Council's work. And I look forward to welcoming new members soon. And our outgoing members are Carol Ann Barkla, Professor Sue Curl, and Sue's with us at the conference, and also Andrea Coote. If you would join me in acknowledging them and their participation. Thank you. Now, some of the members of the Advisory Council are attending the conference and we're wearing red lanyards, so please come and, if there's some feedback that you'd like to give or just to catch up, please do come and make sure that you catch up with us. The Advisory Council meets 6 times a year, and our meetings provide an opportunity for us to hear from the Commissioner on recent achievements, current activities and priorities as well, and on also the Commission's performance. We also consider and provide advice on a range of other matters. We do a deep dive into at least one particular area of activity at each of our meetings, for example, complaints handling, quality and safety monitoring, assessment and auditing, SIRS, or financial and prudential regulatory activities. A second tranche of activities undertaken by the Council involves discussing with the Commissioner and executives the Commission's findings, insights, conclusions and actions arising from its sector surveillance, risk assessment and regulatory processes. Our third general category of work is to contribute to planning and review exercises that surround the development and publication of the Commission's corporate and operational plans and annual report. The work of the Commission and the Advisory Council continues to evolve and is informed by the Capability Review. Now, the independent Capability Review of the Commission undertaken by Mr David Tune, AO PSM, which was released by Minister Wells in July 23, made 32 recommendations. While the government hasn't yet released its formal response, which I understand is being finalised in the context of the budget, the Advisory Council has been briefed on and has discussed with the Commissioner the significant work underway across the Commission to address the issues identified in the Tune Review. Now, that work to lift the Commission's capability in key areas is also vital to the Commission's effectiveness in preparing itself and the sector for the introduction of the new Act, including how to achieve a greater level of transparency by the Commission in its operations. In relation to the Advisory Council Recommendation 6.2 of the Tune Review, this recommended that the Aged Care Quality and Safety Advisory Council be strengthened to provide stronger independence, accountability and oversight. And the Advisory Council is working diligently on this recommendation in particular and its implications in great depth. We've also discussed how we can best realise this recommendation with the Commissioner, the Department and Aged Care, and pivotally, we've met with Minister Wells to understand her expectations of the Advisory Council. We're very clear that the Minister wants the Advisory Council to help build greater trust and confidence in the Commission by standing apart from it and providing well-informed, independent advice and guidance to the Commissioner as well as to the Minister. We're certainly ready and able to do this and very keen to step into this stronger role. One way of achieving this will be to enhance the Advisory Council's direct engagement with stakeholders, with providers and with older people receiving care. And this engagement will be a core part of our work plan going forward. We will continue to support Janet as Commissioner to achieve the impact across the sector that she and her team aspire to and that all Australians expect. I know that we all share the same goal. We all want a thriving aged care sector staffed by skilled, competent, highly motivated workers who enable and support older Australians to enjoy the best possible quality of life to the end of their days. It really is a privilege to chair the Advisory Council and to play a role in striving for the continuous improvement across the aged care sector that we all know is vital not just for the future of aged care, but most importantly to the well-being of older Australians across the country. Now, on a personal note, many of you will be aware that after 13 years across Alzheimer's Australia Vic and Dementia Australia, I am stepping down as the CEO of Dementia Australia. And in fact, today is my last day in the role. And being CEO of Dementia Australia has been such an enormous honour. And I extend my profound appreciation to each of you that I have had the privilege of working with, including people of all ages living with all forms of dementia, their families and their carers, along with the extraordinary team at Dementia Australia, our supporters, and to you, my colleagues across the sector. The incoming CEO is Professor Tanya Buchanan, and Tanya brings a wealth of experience to the role, including her most recently role as CEO of Cancer Council Australia, and I know that the sector will welcome her. In closing, thank you for everything that you do in providing care and services to older Australians and to your commitment to excellence. And I thank your staff, and I thank everybody in aged care that works to make a profound and lasting difference to the lives of older Australians. Thank you so much.
I'm now very pleased to be able to introduce Michael Lai, the Deputy Secretary from the Department of Health and Aged Care. Michael joined the department in December 2019 as the Deputy Secretary responsible for ageing and aged care. And he's led extensive reforms to the Commonwealth Aged Care Program. And Michael is also the Senior Indigenous Champion for the department. Prior to joining the department, Michael held senior executive positions at the Department of Social Services, including as Deputy Secretary. Would you now please welcome to the stage Michael Lai.
Thanks very much, Richard. And if I could begin by acknowledging the traditional owners of the land we're meeting today, the Kaurna people. And can I also give a big warm welcome to Aboriginal and Torres Strait Islander peoples joining us today at the Convention Centre and online. You're most welcome. Can I also acknowledge both Janet Anderson and Maree McCabe, who've kindly invited me to speak today, and acknowledge Maree's contribution to dementia. She's been a fierce but fair advocate for the rights of older people, and I've really appreciated both that advocacy that she's given and also her guidance as we've gone about the reform of aged care. So thank you, Maree. It's a pleasure to see so many people here. And I know that it's been an enormous amount of hard work put in by the people present in this room to make sure that older people are getting the services that they deserve. The Royal Commission described an aged care system that was plagued with issues that were having very serious consequences for individuals, up to and including avoidable deaths. The problems began from the moment that someone attempted to engage with the aged care system, with the Royal Commission finding that applicants universally rated it difficult, irrespective of their background, and it just got worse from there. I want to acknowledge that we share responsibility for that system that we're now seeking to fix. And when I say share, I mean the Department of Health and Aged Care. And turning the ship around has been an ambition of our department, and so we welcome the findings of the Royal Commission report, however bracing they were. And we have worked diligently with government to consider its recommendations and then to consider how to implement them. And now, 3 years on from the Royal Commission handed down its report, it seems like an appropriate time to take stock and reflect on where we have come from and where we're going. In the past, our aged care system was firmly in the realm of crisis, I think it's fair to say. The signs were everywhere and were plain to see by anyone who cared to look. At its heart was a funding model that was slowly strangling services and the viability of our aged care providers. While the funding model was slowly eroding the foundations of the sector, the dark irony was that this was occurring at a time when community expectations about quality of care were rising sharply. Award wages were lower than they should have been, and this led to staff not being attracted to the sector. Inadequate funding led to inadequate levels of care for residents in aged care homes. Inadequate care led to diminishing wellbeing, safety and quality of life, and diminished quality of life inevitably led to diminished dignity, self-respect and self-agency for older people. Stretched resources meant that providers were sometimes unable to supply adequate nutrition, causing health problems that staff members were not trained to manage. This impacted the quality of medical care, medication management and overall support. And that isn't even addressing the mental health issues that arose through isolation or the distress that was caused by our collective aspiration to protect and promote the rights of older people in our care. Then the pandemic came and put an unbearable pressure on a system that was already past breaking point. The toll that COVID took on the aged care system in the days prior to the vaccine rollout was measured in precious lives lost. These are things that we never want to experience again. I could continue, but you all know the story. Most of you, particularly during COVID, were in the trenches fighting to keep the system afloat. So that was then. It's a bracing story. But what about now? I really believe that things have begun to turn around due to the hard work and collaboration between governments, the department, providers, the Commission, consumer advocates, and most importantly, older people themselves. At her address in the National Press Club last year, the Minister for Aged Care, Annika Wells, mentioned that she felt like we have been triaging the aged care system to save what we could. I think we've moved beyond that now. We're starting to see some real results from our collective efforts. These green shoots take many forms, but you could broadly categorise them as improvements to quality of care, improvements of access to information, improvements to quality of life, not just for older people, but for workers who care for them as well. The 15% increase in pay across the sector, which Maree drew reference to, worth around $11.3 billion, that is bringing new staff to the sector, while helping to retain existing staff as well. Anecdotally, we've also heard from some providers that workers who previously left their jobs have also been returning, a heartening sign and a strong indicator of positive change. It's also worth noting that work on the aged care work value case is still ongoing, and so further pay rises are on the horizon. We've begun to make inroads into lifting the standard of care across the sector through things like having registered nurses on site 24/7 to provide clinical care and reduce unnecessary trips to hospital. By meeting our initial 200 minutes of care target across the sector to ensure that people receive an appropriate amount of daily contact with care workers, nurses and support staff. And introducing publicly visible indicators of quality like star ratings. Our figures tell us that aged care residents are now receiving an additional 3.6 million minutes of direct care every single day, an enormous achievement. That's roughly an extra 20 minutes each. And that is across the sector. And registered nurses are now on site 99% of the time, or 23 hours and 42 minutes per day. A vast improvement, albeit one that is just shy of our goal. We know that in some cases, these milestones may have been hard for providers to reach, and we have worked closely with those who have approached us and asked for assistance to meet the new standards. We've also established the Food, Nutrition and Dining Hotline so that residents, carers and their families can get advice or complain if needs be about the quality and nutritional value of their food. Initiatives like this may seem small fry compared to some of the larger moving parts at play in the sector, like the forthcoming new Act or the upcoming Support at Home program. But simply knowing that there's a channel for them to raise concerns if they keep being served substandard food makes a tremendous difference to people. It's the difference between being and not being heard, and it's initiatives like this that contribute to confidence in the sector. We're seeing more green shoots when it comes to people enjoying genuinely informed choice about what kind of care they are after and who is best suited to provide it through measures like Dollars to Care and improved Find a Provider tool and star ratings. Things like increased transparency about what service providers such as yourselves deliver, what you are spending money on, and what the overall self-reported experience of your residents is. The Minister mentioned the success of star ratings during her opening remarks for the conference. It's an excellent example of the principles that we're applying as we implement reforms, because star ratings do not just increase transparency, they also increase competition to provide better quality services over time. And we know this is happening because we keep seeing aged care homes work to improve their ratings. We have also put in place measures to make it easier for people to navigate their initial engagement with the system through things like face-to-face support in Services Australia service centres. There are many more programs and initiatives that I could mention, but the key thing to note is that each of them is intended to address the system deficiencies that I spoke about earlier. And I want to reiterate that as we go through this very large period of change, which is difficult, that the department is here to support you through these changes. And one of the tangible things that we have done is to expand our presence outside of the major cities, to provide regional stewardship by setting up regional offices that can work with local providers to help them resolve issues. Places like Launceston and Alice Springs, and here in South Australia, a new office at Port Augusta. We're not the only ones who have noticed things beginning to turn around. We have been hearing it directly from providers and directly from older people receiving aged care. Our most recent residents' experience survey indicated that residents were more satisfied with the quality of their aged care in 2023 than they were in 2022, a trend that we expect to see replicated this year. We found similar results across a number of different areas where people reported being happier because they had a greater say about the things that affect them, such as daily activities, because they were encouraged to be independent and had better experiences with staff. Although still around 40% of residents thought that the food could be better, and so I encourage you to make use of the training by Maggie Beer and assessments from dietitians if your residents fall short in this cohort. Importantly, 85% of people that we surveyed said they would recommend their aged care home to someone they knew. This is not something that would have happened in the past. So we have more to do in the next 12 months, including a new Aged Care Act and a new supported home program that will replace some of our existing programs, and I would fully expect that at question time I'll get asked about those initiatives. And I want to reiterate that all of these things, the things that we're implementing now and the things to come, represent change, and as I said, it's difficult. It soon be incumbent upon us to think about how to build on this stable base once we get there, and how to think about excellence in care. We'll get through the Act and support at home, I promise, first. But we do need to turn our minds to think about what excellence means, to think further on how to give older people in aged care the ability to direct their own lives, to create a more sophisticated understanding of what dignity for older people really means and looks like in the form of aged care services. And for people such as myself and Janet, and for you, to think deeply about how to engage and lead excellent services in aged care. So in closing, we're beginning to see some encouraging results from our collective efforts to reform the aged care system. The older people that are entrusted to your care as service providers are receiving more personal attention, greater access to clinical care, and are more able to hold providers to account for the services that they're provided than was the case just a few short years ago. We still have a long way to go, with some major planks of reform yet to be implemented, as the Minister highlighted in her address. But we're on our way. Collectively, we're turning the ship around and we're heading in a direction that is better than where we were before. We must not become complacent, but we should also acknowledge that it's taken hard work to get here, and hard work from all of you in this room. And I congratulate you on that, and I encourage you to stay the course. Thank you very much.
Well, thank you very much indeed, Michael, for sharing those insights into the thinking and the working of the department, a clear and very practical explanation. Now there is an opportunity for you to be able to ask some questions of Michael. Of course, you can submit questions via the conference app. And as I mentioned just a short time ago, if you are putting in a question via the conference app, please put that question in the section which says Plenary Welcome and Recap Day 1. So if you're using the app, please do that. There are, of course, as we had yesterday, microphones available in the room at the top of the stairs here. And I'm just trying to see whether we have one down there or not at the moment. I can't quite see it, but there are certainly microphones at the top of the stairs if anyone wants to use those directly. Michael, let's begin. The first question actually is a pretty basic one that probably a lot of people are wanting to know. When will the government confirm the commencement date for the new Aged Care Act?
All difficult questions welcome. So I think that the government is very, very keen to see the Aged Care Act into the Parliament, debated, discussed, inquired into if necessary, and passed as soon as humanly possible. And so we're working very, very hard to turn not just, you've seen a lot of the Act in an exposure draft. There's obviously what we call subordinate legislation, which is regulations. And there's, essentially a couple of missing chapters which represent the supported home program and fees and charges, so means testing elements. And so those are under active consideration by government, and the intention is to be able to make sure that people get access to the full bill, not just the large part of the bill that you've already seen and engaged on, as soon as humanly possible. So months, not years, would be my polite answer. That's the best answer I can give you. But there's certainly a degree of urgency, and we've heard very strongly in the department about people's anxiety to see the Aged Care Act passed. We've welcomed people's constructive feedback on the Act. There's obviously some things in the exposure draft that people really like, and there's things that people think need to be amended, and we're going through that process of looking at all that feedback that you've given us, and to ask the government to consider whether we need to make changes to what you've already seen. So, yeah, high degree of urgency.
Thank you. Another question that's come in through the app. The sector continues to have major recruitment and retention issues, which may undermine reforms such as care minute targets and the new standards. Is the department working with the sector to measure and address this structural problem?
Look, the short answer is yes. Can I just say that the sector's done an amazing job in terms of 24/7 and care minutes, despite the fact that we know that there is some unevenness in the supply of workforce. There's definitely some structural issues. Our intelligence and data tells us that the Fair Work Commission wages uplift has been an absolute game changer in terms of the workforce issues that people have faced. It has enabled people to recruit and retain workers, and reduce reliance on agency staffing. But that's not a blanket issue. So you particularly get to outside of the capital cities, and you still have real issues around the labour force, and the department's paying particular attention to where we see that unevenness. And like that's hard work. Part of the story is the work we're doing with our colleagues in the NDIS and indeed in the health sector to think about how do we make it viable to bring a physio in full time to a Broken Hill or another regional setting. How do we think about it across those care sectors? Because the only way in the long run that we're going to get access to those kind of more specialist positions. But indeed, we've got the same issue with RNs and even PCWs in some locations, and so we're paying particular attention to that. But I would underscore that if you have been reluctant to test the market since the Fair Work Commission decision, or indeed post the next phase of this, get out there, because the experience that we're seeing, we seek data and the like, is very, very heartening.
Thank you. A very short and very straightforward question coming up next. With the introduction of the new expectations, would there be a review of funding for providers?
Look, I think it's fair to say that to deal with residential care first, the department's invested in some serious capability around an analysis of the market. We've invested with IHACPA, the independent prices, in looking at what's happening in terms of costs. And I think our answer to the question is that we can see in residential care that the amount of funding going to actual care is appropriate. So it is now actually covering people's costs. We can see that in the data that providers provide to us. It's clearly the case that in relation to everyday living and accommodation, the story is slightly different. And so the work of the task force, which is now being considered by government, goes to those two parts of residential aged care funding, where clearly we still have work to do. There's no doubt about that. And we understand that if we can't get the residential aged care sector, not just to break even, but to what we call investability, which is making a return that enables the provider to invest in the future of service delivery, that we're not going to get excellent care. We absolutely get that. And so we're committed to that. So we might, people might have a different view about where the funding shortfall is, but we're very clear about that we still have more work to do in that space, and it's under active consideration by government. Support at home, I think, is a different kettle of fish, and I think, one of the problems that we've got to pay attention to, both government and providers, is this is a very, very big growth area with the ageing population. There'll be huge volumes going forward, but as we've seen in the NDIS, we need to be very efficient. We have to have good systems. We need to pay attention to how we do best practice care, because over time, the margins that people might have seen in the supported home area will necessarily shrink. That's been the experience in NDIS. So that's a collective problem we've got to solve, but it's a welcome problem in the sense that we're not facing a shortage of people needing a service.
Next question, are we on track to start the single assessment tool and workforce from the 1st of July?
Look, the answer is that in relation to single assessment and indeed the contracting of our partners who do assessment work, that we're trying to stagger the introduction of these new arrangements. So we are on track, but we're paying particular attention to how do we stage these things. We're doing a similar thing with when we think about support at home, when we think about the Act. How do we give time for people to get across the new arrangements, start the task, and then and see if there's things that we can triage along the way to take some of the reform pressure off people. And so in that space, we've got a large number of things happening, but most particularly, people will be aware that we're out in the market around the contracting of and engagement with state governments around the future of that single assessment service. So I'll probably leave it at that, given that's live.
No, thank you.
Me,
actually, you touched on this a little in your presentation, but there's a question here about the new regional department hubs. What kind of support have they been providing? The question says, examples of what the department is doing out there in regional areas, please.
Yep. So, to pick an example, we've got a particular issue in the Illawarra. Patrick Reed's here. He might grab a microphone and start berating me about it. But there's definitely an issue in the Illawarra. We've got, they've got workforce issues. Definitely. There's some capacity issues in the sense of not beds, but the ageing stock. We've got a large number of people in hospital who are long-stay hospital patients, and providers like Patrick and the local hospital district, the New South Wales Department of Health, and ourselves have been engaged around how do we deal with this problem. Some of the issues are systemic, are national in nature, and some of them are local. And so Sarah Rumble, who's our New South Wales State Manager, has been working with our South East New South Wales Regional Office, and they've been engaged with that group of providers and with the state government directly, sitting down, going through, and in some cases going through patient by patient in the hospital to think about what have we got to change to get this right. And it's a tool in the form of these dedicated staff that we just haven't really had outside of capital cities. And so that's one example. We've got great examples across all jurisdictions. Gives us the ability to get in there at a very local level and work with people. And I would say it's not just to work with providers, it's to work as system stewards. And so that means that, if we see that there's a group of older people who are not getting a service because of some local factor, that we're prepared to engage with that group of people too, to make the system work.
Thank you. I gather there is a question on one of the auditorium microphones, and apologies if I've missed you before now, but the very bright lights make it hard to see people at the auditorium microphones.
Thank you.
Do we have somebody?
Yes, thank you.
Oh, great.
My name
you
is
are.
Jill. I'm from a small, not-for-profit residential aged care home in an MM5 area, so regional. I've been talking to other people around at the conference, and I know I'm not alone in this. I'd like to ask whether the department has a plan to address agency costs. In the past, there was one or two providers, you knew what you were getting, you knew what the costs were. Now we have lots of agency providers. The costs are extraordinary. We're buckling under the pressure of trying to meet the 24/7 and pay these agency costs. I was wondering if there was any plan to either control that or maybe provide some form of supplement that you could apply for.
Yeah, look, great question, and I think and can I just say to you that we see that in our data, that exact story it's a real thing, and everybody obviously understands that we don't want to have people in regions not getting 24/7 nursing and not getting care minutes, and I know providers don't want that either. And so where we do have these unevenness in the workforce or workforce shortages, we still have providers who have high agency dependence, and that is one of the critical factors that determines their breaking even or profitability or sustainability or not. I know it's not sufficient to say that the Fair Work Commission decision is the answer to that, but it is. Don't underestimate the enormous help that gives. But I do think in these areas we need to be much more surgical in working with you and identifying, is it a cross-care health solution where we look to, as we have in some locations where we sort of say, let's think about the pool of health and care workers in this location as being available to all services in the community, and we try and see if we can roster to kind of accommodate that better, which is a kind of South Australian solution that we've kind of been piloting. Is it about providing short-term assistance to providers? And indeed we're doing that in Alice Springs. We're actually providing financial support to help where it's very, very hard to get non-agency staff to come into that town at the moment. What I would say to you is that no option is off the table. It's a real issue. There'll be real limits to to the degree of support. It can't necessarily be open-ended, but one of the values of regional stewardship is us getting in and understanding your issues and seeing if we can sort them out, with the goal in mind of not do we retreat from the high level of care that we aspire to, but how do we help you manage the workforce issues, solve it, and in the meantime stay afloat.
Great, thank you very much. What will have to be our final our final question for this session, but unfortunately on the screen here, I was about to try and read the question. Great, thank you. Something has just changed on the screen, so I'm now able to do that. And it goes, with all these reform and constant changes, what is your view? As a care provider, we spend huge time documenting what is required from the Commission, which leaves us with very little time to provide direct care to our lovely residents.
Yeah, look, definitely an issue, and but can I say that there's unlikely in the short term to be any kind of public desire or anywhere a desire to not have the accountability that we've put into the system because of where we've been. People need to understand that context. It's not going to, people aren't going to say, well, we're going to move away from the level of transparency that we've gone to. It's not realistic. But I think that the thing that we are tracking very strongly is how do we kind of think about helping you to be able to do that documentation without the extra red tape, without the extra handling, with the it being highly manual. And so the very large investment that we're asking government to make in the ICT development to support the sector, we have our eye on trying to make that task as simple as it possibly can be for you, because we share your desire to be at the side of a resident, not documenting their circumstances, but engaging with them and helping them to determine their day. And so, be patient about that. I think we're at a point where we'd say the requirements certainly outstrip the sophistication of our collective ICT capacity, but we understand that and we're committed to sort of make that, to deal with that, because we totally we're with you. We want you by the side of the resident, not filling out forms.
Thank you. Thank you all very much indeed for that flood of questions. We have many more questions that I can actually see here, but time has defeated us. But thank you so much for being part of the conversation. And if we weren't able to get to your question, then hopefully that will be part of your continuing conversation as the day proceeds. But for all of those responses and for all of that analysis of the situation at the moment, would you now please thank Michael Lai?
Thank you.
Now we're going to turn our focus to the perspectives of older people receiving aged care and what the new Aged Care Act and the strengthened quality standards mean for them and to them. And so let me invite our panel now onto the stage for this session. First of all, Commissioner Janet Anderson will be joining us again on the stage, but joining her on the stage is Craig Gear, OAM, Chief Executive Officer of OPAN, the Older Persons Advocacy Network. And joining by Zoom is Pat Sparrow. Pat Sparrow, Chief Executive of COTA, Council on the Ageing Australia. Now, Craig was appointed CEO of the Older Persons Advocacy Network in 2018. He has a Master of Nursing in Critical Care and over 20 years of clinical and senior management experience within the health and human services sector, previously serving as board chair at Seniors' Rights Service. And he's committed to connecting and improving the health system for all Australians and has been using his experience to drive better outcomes for at-risk communities for more than 20 years. Pat leads the peak body for older Australians, taking a very constructive approach to building an inclusive and a positive future for older people. Her goal is to eliminate ageism, which, as she says, should be as socially unacceptable as sexism and racism. Committed to building a more inclusive Australia that values the contribution of older people, Pat's career spans community, disability, aged care, health and advocacy roles. She has experience from the perspective of not-for-profit, public service, advocacy, ministerial office and, perhaps most importantly, as a support to her own ageing family members. And Janet is going to take over now to facilitate this discussion. So as I hand over to Janet, will you please welcome our panel?
Thank you, Richard. Good morning, everyone. We've had a very strong start to today's proceedings, so no pressures, colleagues. We'll see if we can continue the lift. I actually want to answer the last question that Michael was given as well, but I'll move on and resist that temptation. We don't ask you to document too much, but we'll come back to that. In this session, I feel very strongly about that. In this session, I am delighted to be joined by two colleagues, Craig and Pat. We spend a bit of time together, and indeed, as recently as last night, Craig and I were talking about some of the matters I expect we're going to cover today. The point of this discussion is to explore through Craig and Pat's work with their respective organisations and in the engagement they have with the broader community and particularly people, older Australians and also people who represent them, exploring what the new Act means for the delivery of person-centred care to older Australians, both now and in the future. And many of you would know Pat and Craig and their respective work. They have actually spent some time recently going around the country, they and their representatives, listening to members of the community, to older people, and taking a sounding from them on what they think about, whether they know about, but what they think about the reforms which have been implemented and are coming, and also to the extent to which it gives them confidence or something else in aged care overall. And I think we will get to hear a little bit about that in the course of this discussion. The Commission has also been very energetically engaged with older people. We have a Consumers and Families panel, which gives us access to over 300 individuals who are either recipients of aged care or represent those interests. And we use that group extensively to audit our own products, to check our thinking on the way in which we engage with older people across Australia. And they have been vital to developing our understanding of the presentation of information, but also what information is most useful to people as they consume or seek to consume aged care. We are also doing some really important work in relation to subsets of the community. We have a specific reference group now on First Nations people. We're very pleased to have as a new member of that group, the inaugural group, Andrew Kelly, who's here today as the inaugural Aged Care First Nations Commissioner, which is just great. We also are looking at doing additional work and in the early stages of working with the group on culturally and linguistically diverse consumers and also providers, and trying with greater clarity to hear their voice and understand how we connect with them and appreciate their story and what's important to them. This session today is neatly positioned between the work we did with many of you in the workshops on Tuesday, where I actually chaired a session on hearing the consumer's voice, which was fantastic, and certainly the Commission gained a lot, and I think the people in the room enjoyed and appreciated the experience of sharing their stories. But also the work we're doing later today in understanding the role of governance, and particularly boards and the governing arrangements, in ensuring that the consumer's voice is front and centre in the decision-making process and the way they set priorities and set their course of direction, their course of action. So there will be time for questions. We will make sure that we let you into the conversation because I am sure that all of you have something to contribute. But in the first instance, I do want to give some time to Craig and Pat. And my understanding, Craig, is that we're starting with a video that you and Pat organised to produce. Do you want to introduce it briefly?
Sure. Thanks, Janet. Acknowledging the Kaurna people and thanking them to allow us to meet on their lands today. And this was, I suppose, important. Pat and I saw that it was really important to have the voice of older people in the room here today as well. We saw a little bit of that yesterday in the video, I think, that Lisa had put together. And this is a theme I'm seeing grow and emerge through aged care. We've seen it in the mental health space when I've worked there. We've seen it in the disability space. Our older persons reference group at OPAN constantly tell me nothing about us without us. And partly this video today is really to bring their voices into the room, but for them to say what they're looking for from aged care and what a positive experience of their rights being upheld, what it would look like.
My aged care experience would make me happy if a service provider was meeting my rights. They've listened to what I want. They're giving me the services that I want, and they're high quality services and cost effective services.
My experience would look quite different, and that I would be able to do short courses, learn new skills, and experience more social interaction. I would feel far more fulfilled in my life.
But when they're upholding your rights, day-to-day life is enjoyable. All my decisions about me come through me. I'm the one who's consulted. It's important to remember that I'm still a person and I still have the right to make my own decisions. I like to make my own bed. I like to get up when I want to get up, all that sort of thing. So you're allowed to, within reason, you're allowed to live the life you want to live.
Your dignity is safeguarded all of the time in every way. The staff are absolutely marvellous in most applications, so much so that I consider 3 or 4 of the staff to be part of my extended family.
It would look like or feel like as though somebody cared, as though I had really got their attention and that I was not a commodity. That just meant dollars. Mentally, I would not be stressing myself. I mean, I'm in my late 80s, turning 90, and I think, oh, jeepers, how will I cope then? Will my mental ability still be okay? Well, I want to know that I've got somebody who is going to see me through that.
Well, an aged care home should feel like a home. You're working in their home. They're not living in your facility, it's a home. And that's true, that's what it is. We live here and it should be respected as our home.
And that I'm treated with respect always. Respect in the design of the package, respect in the delivery of the package. As an older person, I'm still a person. I still have value as a person. I still have human rights as a person. And I am not a disposable character that you just need to do X, Y, and Z. Tick the box and off you go.
It's a very powerful set of statements right there. If I can start proceedings, Pat, with you, and this, it will be difficult to do in summary form, but if you could take a grab from what COTA and OPAN heard as you did around the country tour, what are some of the key themes that you were hearing when you asked people, do you know about the reforms? What do you think about the reforms? Are you optimistic about the future? What is your level of confidence and what would you like it to be? What did you hear? Can you grab something for us?
And I'd just like to say good morning to everyone and apologise for not being there in person. I'm a novid no longer. I got this far through the pandemic without having COVID. So the only thing that prevented me from being there in person with you all was the fact that I've got COVID, but I'm well on the mend and very pleased that I was able to join this panel today because the topic is so important and so dear to my heart. So I'll try and do a grab. I was trying to see if I could come up with a fancy acronym actually for you, Janet, this morning, because I'm feeling better and I'm feeling a little bit bored at home. But I couldn't. But there are 3 things that I would say were common in all the conversations that older people said to us around the country, but also when I talk to older people generally. And actually also when I think about myself or any of my contemporaries or anybody at any age about what things actually matter to them. And I think this is an important thing for us to think about. The first thing is respect. People want to be respected. That was a really common theme across all of the conversations. They want to be listened to. They want people to listen to them, to really listen to them, not do what we often do when we're having a conversation, listen because we're getting ready to what to say next, but to actually listen to what's important to them and to believe them and to take action on it. Those are the things that really came through as the themes. And Janet, I think you touched on confidence. I think there's a positive feel that there's a conversation about rights and about changing the system. But the confidence is a bit ish. They've, older people I'm talking to have heard some of this talk a little bit before or seen some positive signs or seen things being developed. and talked about, but they're not really implemented. So they think a change is coming, they look forward to it, and then it doesn't quite pan out the way that they were thinking it's going to. So I would say there's an ish confidence about it, but I think those themes are common across the conversations we've been having.
Oh, thanks, Pat. Thanks for that opening. Craig, I see you nodding. You have a similar sense?
Yeah, it's interesting because we've heard it as we've gone around the country. I've also heard it from people like Leslie Foster, who's a home care recipient in rural WA and is a member of the ACPA Consumer Advisory Group. One of the topics that Leslie wanted on that agenda for ACPA to consider was broken trust. And it's kind of been a bit of a theme through yesterday, and some of your words yesterday was around how do we build back trust? And I'm no Dr. Phil, but I went and sort of had a look and was like, how do you actually earn trust? And it is about the words matching the actions or the actions matching the deeds. And so there is something about this, about why is the confidence? We've done all this work, there's been lots of investment. Michael talked about all these great initiatives and also the really hard yards that aged care workers and the providers have put in place to get us to 24/7 nursing, more minutes, but the trust is still having to be built back. And there's a number of things that we can do to do it. The Rights-Based Act, the positively upholding those rights, but there's probably when things go wrong is what we do then. That's when the rubber really hits the road then.
Okay, a lot of talk about Rights-Based Act, and that has been the language that has been used by the government and by people generally when they talk favourably and in anticipation of better when the new Act is introduced. Let's unpack Rights-Based Act. And you and I were talking about this briefly last night. It can confuse, it can be understood in different ways, and for some providers, and I've had these conversations with some providers, they are very insistent that rights come with responsibilities and you can't consider one without the other, and this is going to get very chaotic very quickly. Now, that's not an illegitimate view, but I think it speaks to a bit of muddled thinking that we collectively need to work on together. Craig, I'm going to start with you and then come to Pat. Unpack that a bit for us, would you?
Yeah, I think importantly, we've all got a piece to play in this. Our aged care advocates, us as consumer organisations, empowering older people with their families as well, to stand up and say, hey, family member, this is what I actually want, and you need to respect that, and don't come in and take over, which we know often happens. But I take myself back to 2019 when Daniela Greenwood, who works a lot and has been working with Mercy Healthcare in the past around this area, she played a video to me of this nurse coming into the room and saying, come on, time for your shower, get up and that. And it actually brought me to tears because that is what I had done so many times in my nursing career, of just walking through, and it was about the task, it wasn't about the person, and it wasn't about that. So simple things that we can do in taking the myth away about this is about thinking about the daily interactions, those simple things that we do that's going to uphold the rights. As a nurse, I have that power. That power is over the person to get them into a shower, whether they have a shower or not, or whether they get to lie in because they've been watching Netflix last night and they really were interested in that. So this is about, and this is why we're really strong about not the mutual responsibility so much, because we have to shift the power dynamic. We have to bring it back into a more balanced relationship. That's what older people are telling us that they want, and we know providers can do it, and we know that they do it. It's almost getting that into our DNA. How do we do that the power dynamic's more balanced? The responsibilities, the mutual respect for rights will naturally flow from that.
It's a nice way of conceptualising it. Pat, what do you want to add?
Yeah, look, I couldn't agree more. But there are a couple of things I think to draw out, and that is that there aren't many times where I, as an adult woman, would think I didn't have human rights. And so it's a little bit of a shock for people to think that in aged care they don't necessarily have the same level of human rights. Now, I know that a lot of people in the room wouldn't think that's right, but you need that fundamental underpinning and understanding to ensure that human rights are enacted. One of the things that I really do think underpins some of this thinking is ageism. And I do need to talk about it. And I want to touch on 3 types of ageism, really, which is that we all have our own internalised ageism. And what we see with that is that we limit ourselves, and we place a limit on ourselves about what we're going to do. So we all do that to a certain extent. What we see play out in care settings quite often is benevolent ageism, not just aged care, in health, in a range of areas, where we put assumptions on another person based on their age. And there were some good examples from aged care recently, which possibly underline some of the things that Craig just talked about. The work that the Human Rights Commission actually did in doing some training in aged care on human rights, with staff who initially, before they did a workshop, said that they were not ageist. They worked in aged care because they loved older people, and they weren't ageist. But at the end of a 90-minute training session, they started to talk about the fact that actually they were ageist. And one example that stuck with me is the woman who said, I realise now that I yell at everyone because I have determined that because they're a certain age, they can't hear me. So I'm yelling at all of them rather than actually spending the time to think about and find out, is this person able to hear me? Do I need to be able to speak up? Do I need to stand in front of them so they can see I'm speaking to them? So I think that there's that kind of, we know what's best for you, benevolent ageism that underpins it. And in a way, it takes away from people's rights. And then we do know that there is systemic ageism, and I'm sure that some of the topics around dignity of risk, etc., and I know that's a difficult topic, but some of those things would probably come through. So I think the question is, when should you not have human rights? And it's certainly not at any time, and it's certainly not when you're in aged care. And how do we make sure that ageism doesn't underpin our own, in the way that we act, but also the way that we view and treat people and respect, listen and act on what they say?
I think what both of you have illustrated is that when you ground the idea, the abstract concept of rights in the reality, in the lived experience of both the older people and also the staff who are interacting most often with them, you actually have a bit of an aha moment, don't you? You say, oh, I get it now. Yeah, this kind of makes sense. And if I were to put myself in their position, I walked in their shoes, that's exactly what I would want and expect. And it would allow me to be respected as an individual with preferences and goals and values all of my own. Pat?
Because, Jana, a useful thing to think about in that space is that actually, if we're lucky, we are all an older person waiting to happen. So some of us might be closer to it than others. Some of us might be closer to it than others. But I don't know, and I've not met any older person yet. And I'm 60 now, so I classify. I'm not all of a sudden, there wasn't a click of the finger where the things that mattered to me no longer mattered. Or I would be really happy for someone else to make a decision or assume they know everything about me. There is no magic moment where that happens. And in fact, when you talk to older people, they talk about how they, get a shock when they look in the mirror and see that they're 70 or 80, or they get a shock about all of the things that have happened in their life. So I think it is precisely that, and not othering.
Yeah.
We don't, when we turn a certain age, we're not all of a sudden somebody else that is not recognisable. And I think we have to recognise that in ourselves to be able to recognise it in the people that we are there, ultimately to support.
Craig?
I go back to what Rosemary said then in the video. For me, someone making my bed, when you see how messy my bedroom is, would be great. But getting to know what Rosemary's wishes and preferences are, it's a pretty simple thing to know that, how do we get to know who this person is, but what they want? Rosemary wants to make her own bed. That should be easy for us to do. But we've got to take the time to get to know people's wishes and preferences.
And also, and taking us briefly into a far more complex discussion where the individual wants to do something which is utterly dangerous and almost life imperiling, the ways in which you negotiate that conversation. I mean, there's the dignity of risk, Pat, that you've raised, and we often hear the oppositional statement, there's dignity of risk and duty of care. Well, I think that's a fairly sterile opposition, and I think you need to push past that and understand individuals, as you say, as you find them, where they are in their lives and the way in which they want to be supported to live their best life. But I think what you're implying in some of what you were saying, Craig, is that it's not about taking the person and everything that they present, and that's what has to happen. Like every relationship we have in our lives, it's a negotiation, isn't it? It's I will come to understand you and I will respect you as an individual with individual choices and agency, and I would like you to do the same for me. And let's have a talk about why jumping off the roof probably isn't the best choice you can make, but we might see what other ways there might be to get the adrenaline shot. You know, let's have a conversation about this. I hear you. I understand your appetite to take a particular risk. How can I help you exercise that choice in a way which is going to keep both limbs intact? You know, that's the conversation. It's not your rights, my obligations. It's your rights, your expectations. Let's talk. What can I do as a care worker to assist you in realising that ambition for yourself in a way which is going to keep you broadly free from harm? Great.
Yeah, and in life there's always trade-offs, there's always negotiation. That has been the collective sort of the statement of rights coming into the new Aged Care Act. Yeah, the right for pets, if everyone wants to have every pet and Noah's Ark and it's all going to be in there, it ain't going to be the way it's going to be. But there will be discussions about how do you facilitate that. If someone has got a connection to a horse and that sort of thing, maybe people going out and staying connected to the community, that's their right as well. It's going to take negotiation, it's going to take discussion. That's probably the biggest thing, is the discussion about what's important to you. Gwenda has talked to me, Gwenda Darling, who's on our reference group and does a lot of work and is on the Council of Elders. And she talks about even just in the daily care. Have you sat down and talked to me about what do you want to achieve this week? What do you want to get out of this home care experience? What's your priority? And that's the challenge. And doing that is upholding people's rights. Simple as that as well.
Okay. Question without
notice.
Pat.
I would just add to that, you know, with a personal experience with my mother, who told me that the thing that would have made the biggest difference for her experience with an aged care service was if someone had sat down and taken the time to talk and listen and then acted on what she said. I mean, all we're really talking about is, you know, conversations, asking questions and supporting someone. And I mean, I think that's the fundamental basis of what the big shift is going to be.
Yeah, and that's one of the biggest things that come through to our aged care advocates, 37,000 cases of support last year, and that's the biggest issue. No one listened, they didn't communicate. If we could get that right in aged care, it's a fundamental part about building back trust.
Yeah, I had my father had a friend in aged care, and she was made resident for the day, and I know numbers of you have programs which are similar than that, and she had a wonderful time, and she said the biggest bonus of the entire day was when someone came to her and asked, what can we do which is going to make a difference to your life today and going forward? And she said, if you could move the clock on the wall so I can see it from the bed. And I thought, she had to wait to be resident of the day before she felt she was able to have that conversation. It goes back to the power dynamic question, doesn't it?
It does, yes.
Understand the individual. Pat?
Yeah, no, I think to your point about, you know, when we talk about some of these things, we automatically go for people who are going to want to go skydiving. It's often much simpler. It's often much simpler than that, like move something so I can see it, or, you know, so I think this is the importance and the power of having a conversation and understanding who the person is and what they're wanting to do and how they want to live their life. It's unlikely that you're going to have all of your residents or all of your home care participants wanting to go skydiving or jump off a roof.
Indeed, one trusts not. I'm going to ask a question without notice because that's what I do, and each of you will have a view about this, and you're talking to a room full and live streaming to numbers of providers, and there will be different perspectives on this, but I'm intrigued to know what you think. There is the leadership that's required at a whole of organisation, whole of service level, which establishes this as the expectation going forward. But then there are the skills and techniques and the awakening, if you like, the realisation by individual staff that this is a better way to go, that the nature of this interaction, getting to know the individual, pausing with them, even though you're time poor, to have those 2 or 3 sentences conversation, which are going to make such a difference to that individual's sense of being seen here now. What's your view on how much of it has to happen from the top and how much of it can come from the bottom, where individual staff are motivated to make a difference in people's lives? Craig, do you want to start?
It has to be both. It also has to be working with our services coming in and helping people and helping train people as well in this. The work that Maree's done, and acknowledging Maree here today and her last day, but having done the virtual reality dementia training, when you walk in someone else's shoes or you see it from a different perspective, boy, that is powerful. And does that make you go, aha, back to the aha moment? So we actually need to get some training in for our frontline workers, because that's the day-to-day experience where Margaret, as she said, it will make me happy. But it's why I suppose we're so passionate about this Rights-Based Aged Care Act and getting the Statement of Rights legislated and enforceable and upheld for when things don't go quite to plan, because it is going to shift. It's going to shift. It's going to make a more enjoyable interaction between aged care worker and that. And the times I've seen this really done well, a friend of mine was a home care worker, and she was there working with a Greek gentleman, and she sat there and worked with him, and he wanted something that the family didn't want, and her to go in and advocate for that, because she was going, we don't have to do this. Wait, that. And she went and she then negotiated with the family and said, he told me this is what we wanted. This is what's documented in his care plan. This is his right. Let's go and do this. And that made for a much more balanced power dynamic, but also a better action for the older person, better action for the worker as well. But we're going to train people in that.
Okay, so training's fundamental, and I don't think there'd be any disagreement in the room about that. Pat, top down, bottom up?
Yeah, it's both, but I think that we know that people will model and copy what they see leaders doing. And so, you know, it's really, really important that those people in a leadership role are setting the right tone. And I think we only have to think back to what we learned through the COVID pandemic. And I know that we don't really like dwelling on that. I certainly don't, and remember very much what I was doing at that time. But authenticity, spending time with people, showing yourself to people, you know, doing all of that stuff as a leader through the COVID pandemic is what made teams stronger and what got people through. Certainly was the case with the team that I was leading at the time. It was really important to model and to do that. And when I said that I was having a bad day and needed to go back to bed and pull the quilt over my head for an hour before I got up, it made it okay for other people to do it too. So this is going to be the same change. If you as a leader are saying it's absolutely necessary that you spend time, you ask questions, you do all of that, and you think about things differently and you model that, staff will take their cue. And you're right, there are staff who will naturally do it, but they'll still be looking to see, staff will still be looking to see, is it serious? Do they really mean it? Or are they still going to be checking on, you know, have I done X, Y, Z within a set time frame? And I know that there's going to be those struggles, but it has to be led from the top to give people permission and to change the culture. And that's what we have to do, is change the culture. People want relational care, not transactional care. And that's kind of where it's unfortunately sort of got to.
And the other thing I think the leadership team can do at the facility level, but at the governance level as well, is make sure that their restorative justice pathways are in place. And that's where we're going, I think, with the Commission and how it wants to manage complaints, but also what happens at the local level, because we want it resolved locally. But that's about having a framework there that is open, that actually says we've stuffed up and we can do better. And that was one of the things I looked at. How do we rebuild that trust when things go wrong? And that's what the leadership team can do. It's the, what are we apologising for? Why are we doing it? Because we realise it's had an impact on you. Having that empathy to say, if that happened to me, that would be, I would feel the same way as you did. And here's the plan of how we're going to do it better. So this is a believable plan, not promising the world, but this is how we're going to do better next time. And people want to hear that. How is it going to be prevented so someone else doesn't have this same experience of that? That's the leadership stuff that the governing body, but the local management can put in place as well.
You're right, Craig, that's absolutely critical, because we know if people's experiences are denied, it has such a negative impact for them, but it is more likely to result in unpleasantness and difficulty and ongoing difficulties. If you can acknowledge someone's experience, accept responsibility. And I, you know, I hear from some individuals who've got services that as soon as it's acknowledged that there was an issue, yes, that did happen, we're very sorry that happened to you, they can move on to have a different kind of conversation about what might need to happen as a result.
Okay. I want to take us to personal agency for older people and the possibilities of cultivating that, because some people are naturally different, and we've already talked about the power imbalance. But I'm interested to hear your views on the training opportunities there and whether providers might actively lean into that space to elicit the feedback in a comfortable, safe environment by privileging the concerned voice. But before we get there, you can think on that question. I'd like to invite in those who are watching online and those in the room. Now, my monitor says there isn't a single question, so either you've been particularly slack or the monitor's not working. So I will need to be guided one way or t'other. But there doesn't appear to be any question yet that you have raised. So the invitation is there. Please feel free, because I genuinely want to hear what you have to think about.
There they
Monitor is not working. I'll just get rid of this. All right. Is the video compiled by OPAN and COTA publicly available for providers to utilise with their teams? Craig.
I'm just looking directly at my manager of strategic engagement, and I think that we will release the video because I think it's powerful voices that we want to get out there, particularly as we move forward with the new Aged Care Act, the rights-based. Going to your question, Janet, about privileging the person, I think this is why we think it's so important that supported decision-making is actually put into the Act. And providers often tell me, and they say, it's really difficult with families. And it's really challenging negotiating that family dynamic, which is often broken down. Supported decision-making actually privileges the older person's views more than it does the family. And it says to them, you've got to work it out. You've got to work it out early. You've got to document what the wishes and preferences are. Family member, you're in a really privileged position to do that. And putting that into the Act balances again the power dynamic for the older person, keeping them at the front and centre, even with their family. And that's going to help providers. But we're going to have to train providers, we're going to have to train family members in what that looks like. And, hey, it's my decision, respect my decision.
And Craig mentioned something about documenting wishes. That's interesting. Moving on. We talk about ageism, but I question the use of labelling people as older people, Michelle says. We interviewed over 130 of our residents. 75% stated older person does not describe them at all and felt offended that they are labelled old.
Yes.
Pat, do you want to start?
I think that's true. And I think that in a way it's what am I trying to say? In a way, that's almost what we have to change a little bit. There's nothing wrong with being 60 or 70 or 80. I think, you know, we've lived in a culture where to be younger is much, much better. And so people don't like to, and you can see it with advertising, you know, if you want to get someone who's 60, you know, you advertise with someone who's, you know, 40. People identify as younger. So I totally believe that's the experience that they've had. And it's great that people feel that way. And it's not that I want people to sort of feel old, but I think there is a sort of a squeamishness about getting older. And, you know, I would say that's part of my internalized ageism. I still, you know, colour my hair because I got told once that grey-haired ladies don't get listened to. And the more that we invest in those patterns, the more we kind of reinforce them. So I totally think that that's right. And it's not about me saying I want people to think that they're old, but it is about saying what we all need to do is claim whatever age we are, and be proud and be ourselves and not try to be 20 or 30 years younger.
Okay, I might move us on. Dennis is taking us to the question of language and the use of the word consumer, which is it going to feature in the new Act, and what that implies, change to the noun, to the resident, to emphasise that it is their home. I don't believe we use the word resident in the new Act, although I'll look towards Michael and his team for clarification. My understanding is we're using older person, which goes to the question we just answered. We certainly have had very mixed views expressed about consumer, and I think generally towards the negative. It worked for a while, but I think it it seemed to subtly objectify the individual in a way which was quite counterproductive. So my understanding is older person is the preferred language, and I think that's neutral. As Pat just said, and it kind of backs into her answer, we need to get over the implied prejudice that is attached to the word older, understand it as a person who happens to be in a particular age group, move on. They have
I heard a
needs.
wonderful linguist talking about the fact that we need to reclaim the word old.
Yes, and keep it focused on person, whatever that is. Participant. We've seen the difference this makes in disability and some of the rights-based approaches that has started. It's not perfect in disability, but it has shifted about where that person is felt within the dynamic and the relationship of support and care.
Right. Okay.
Consumers also seem to be very market-based. And I think that the big shift in talking to older people over the last, a good few years now is that they're saying if they want relational care, consumer doesn't really fit with that relational care. It is about people and individuals.
All right. We've got a question about reablement, but I think, Tim, you've framed it in a very interesting way. Let's go into it. Reablement is an essential component of independence, but so many older people don't choose this service. What do workers and providers need to do to increase participation? So we know in general that reablement is a really good idea and assists people to sometimes recover lost function, particularly if they've had a period of illness and especially if they've been in hospital for even a brief spell where they come back with reduced muscle tone and all sorts of things which can be recovered if you take it very seriously. But what Tim's saying is we're not getting a high level of pickup. This is a really interesting framing of the question, because it's about what we know and our expertise that something will make a difference, but what the individual is deciding for themselves, possibly with less information. Craig, what do you do about that?
Yeah, and Mona, who was on our reference group and had said, no, this is not just about maintaining that. I'm at this level and I want the choice to be able to stay at this level as well. Again, the conversation about whether this is, I should be running more and doing more exercise as well. So it's also to us as well. What is the benefit of it? You feel better, that sort of thing. You might engage more in the community. So it's selling the benefit, that sort of thing, but also respecting choice or finding small ways in this done that is actually acceptable to the person. Again, it's not the one size fits all. And I think that's trying to work and say the tail of it. What would work for you? What is your priority in life? Is it just maintaining function, or is it being able to get out to the shops more, which we can help you to do?
Yeah.
Okay. Reablement doesn't sound like something that you'd really like to have done to you, does it? I don't know that I'd want to be reabled. So I think it is, and I'm sure that people break that down, but it's not an instantly appealing kind of word to me. I mean, what does it mean? So I think talking about it in the way that people would understand what it means, and as Craig's saying, for something that matters to them. So, a great example, I do remember when I was first learning about what reablement was, and I still didn't think it was a great term then, but was about somebody who really liked going to the letterbox to pick up their letters and having a chat with the post office. And they started with that really small goal. What we're going to do is just help you so that you feel confident to be able to walk to your letterbox. So, picking something that matters to the person. Because if you think about it, most people want to stay at home because they want to maintain their independence. They want to be able to do those things. And I'm sure people in residential care have those goals as well. But that's what I hear older people expressing. I want to continue to be able to do this for myself. Maybe not, I'd be happy to give up my cleaning. I get that thing. But, majority when you're talking to someone older, they actually talk about how they want to keep their agency, how they want to keep their independence. And I think working with that and picking things that really are meaningful to that person would possibly help with that situation.
Yeah, very useful. Okay, I want to get through a couple more questions if we can. There are lots here, and obviously we're not going to get through all of them, but we will absolutely take them on board and ensure that our information back to the wider group of providers is informed by these sort of interests. So the next one is, and Aidan's asked it, what's the best way, in your opinion, to definitively shift staff mindset away from transactional care to person-centred relational care, whilst noting the high number of tasks they need to do each day? Now, this is a familiar concept. This is absolutely where you are. because you know there's a certain amount you need to get done in each shift, and there's no excess time which is available. My view on this is magic moments, which is that every single interaction that is had with an individual, an older person receiving care, by whomever is passing them, is a potential moment of joy. Craig, do you have a view on this?
Yeah, I think it is the moments. I think it might have been Julia or someone spoke yesterday about not seeing the plate that's sitting in someone, not seeing not seeing the funding source that's coming in attached to this person. It's about them having those incidental conversations, but it is a program of work. I want us to all work together on this as we build the implementation and operationalising the statement of rights. We need to work together on this because it's going to have to be, how do we embed this into our daily practice, as opposed to bang, this is your half hour to have your rights upheld, the rest of the day we go to transaction. No, it's going to have to come into our DNA and our relationships.
Yeah. Let me move on.
Can I just add too,
briefly,
it's not going to just be about moments of joy. It's going to be about moments of sadness and moments of depression, and people actually being able to talk about those things. And I think, it is a big cultural shift and change, and it will make some people uncomfortable, I suspect, but agree with Craig. And there has to be, training and support and a real mindfulness at all level of the organisation about the shift and the change that's occurring.
Okay, possibly the last question. We'll see how we go, but I'm very keen to take us here. What are we doing to ensure that people with dementia are getting the best care? Now, each of you, and I'll invite you to make this a closing comment, has a perspective on people who aren't as well placed to express their own views, to exercise choice independently for themselves, who rely on others who may or may not be in their lives. What do we do about that in terms of a rights-based act and the expectations we've articulated this morning? Yeah,
and I think we're really looking forward to the National Dementia Action Plan also considering human rights of people living with dementia in that as well. Partly it's making sure the supports are in place, making sure that we've got the supported decision-making framework in place, making sure we're engaging our aged care advocates to come and work with the person and to be there at those times, because that's a protective mechanism to make sure their rights are upheld. It's also documented early, because Teresa Flavin, who's a staunch advocate, went to the UN last year, first time lived experience was represented at the UN on the rights of older people, but talked about, I want an advanced social directive. I want my voice documented. Interview me now so it's known what I want in the future. And I think that's the power, to have that voice of the person themselves. Yes, we need to do better in this area, but that's the key to supported decision making, to hold their voice, know what that person wants.
That's very powerful.
I think that is really important, but I think it's also, so I would agree with that. And obviously, at different stages, it's very difficult, but it's also about being with where the person is at and not assuming that because they have dementia, which I think has been an assumption in the past, that a person has dementia, they actually can't contribute to the decision making, or they can't have a say. And I think that, we've got to shift that. And perhaps just a personal experience to share it with. I had a father who had dementia and an auntie who had dementia, and witnessed a beautiful moment between them. They didn't really know who the other person was. They didn't remember, but they were sharing fruit, and they knew that that person was someone important to them. They were actually feeding each other fruit. We were all sitting there with my sisters and my cousin actually, and we were crying, because in that moment you could see that they actually did know who they were to each other in some way, although they couldn't express it in that way. So I think actually making sure that the voice is recorded, but also seeing where the individual is and going with where they are as well, and accepting that it may not be presented in the same way as you or I might present it if we don't have dementia, but they are still able to have their say and communicate in many ways what it is that they want and what they're feeling, and that we need to always listen. And I'm reminded of, hearing that horrible statistic. It was a few years ago now, and I hope it's much, much lower, that, some of the behaviours that people with dementia had was undiagnosed pain. So, I mean, it goes back to asking questions, listening, and being with where the person's at, so that you're picking up all of those clues and not missing important details that you need to be aware of.
Thank you, Pat. And that brings us to a close for this session. Thank you, all of you who participated and contributed so strongly to the questions. As I said earlier, we will gather those up and make sure that they inform our communications from here on. My particular thanks to Craig and Pat. I have it on advice that it's Craig's birthday today. So happy birthday,
Yes.
Craig. And I think this has served us a treat, and it certainly allows us to think about all of these things as we go into the following sessions. So thank you both, and thank you for being so giving and thoughtful in the contributions you've made and that you continue to make. I'll hand you back to Richard briefly for some housekeeping before we break. Richard.